We're doing a Beyond the Read project where we're capturing readers' participation in reading documents and from the journal, from the Pediatric Therapy Journal. So it's a really great way for therapists to learn about current trends in practice and gain clinical education units.
Now, generally speaking, you get research papers in pediatric physical therapy. They're extremely interesting. The data is all presented very rigorously. So what is it that you're adding by having this Beyond the Read service now?
So what that's allowing therapists to do is to read an article and then get continuing education credit for it. So they would read the article, and then a group of us from around the country have pre-read the article and developed objectives that we think are key points from reading the article. And then there would be a small quiz or test afterwards to ensure that they are synthesizing the information from the article.
We offer only online learning. It's just that Beyond the Read, these are articles that were originally published in the Pediatric Physical Therapy Journal. So we just upload that article. So like you say, somebody sitting in Bangladesh can now download, read it, and then they can, they will learn from it, and so then if we do need to answer questions or something, they can always pose a question to us, and then I'll send it on to the pediatrics folks. I'm kind of that middleman.
Right. So really. Are you saying then that the new service you're offering is that it's interactive?
It's as interactive as we can get being online. It's not virtually interactive. It's not like you and I are talking right now. But if somebody were to say, I just read this article and I've got a question on it, I would pass that on to the Academy of Pediatric Physical Therapy for a response. I mean, we always try to make sure that we respond as needed to anyone who asks those questions. I think most of these Beyond the Read are self-sufficient in providing the knowledge, but you never can tell. Somebody can ask a question, and that's, like I say, I'm that middleman. If they have a question about it, then they come to me. Mm-hmm. But anyone can access the Learning Center from anywhere in the world.
I think Beyond the Read, because it's capturing your interest or an article that's of your interest. The panel that's deciding which article to cover is really kind of looking at making sure that we have a variety of articles. We do have clinicians and faculty who are on the panel, so we get a very broad perspective of clinicians' needs that are out there. But I think by highlighting certain articles that we really feel are of clinical interest to use within this program, that we can help therapists really kind of hone in on articles that they might choose to read or choose to focus on.
I'm really excited about this. I mean, it's something that we've done in the past. So years ago, it wasn't my original idea. I just am excited to be part of the group who's kind of brought this back to life. So it's really, like I said, being able to do something I think we're all already doing, which is reading articles in our journal, but then to be able to get CEU credit for it. So, I read this article, I've learned something, I take a post test, and then I can get CEU credit for it. And how simple can that be, and kind of at my convenience. So that really is where it started. There was a gap when we did this before. They kind of stopped in around 2016. We've rebranded it, called it Beyond the Read, branded those courses that were previously up till 2016. And now here in 2021, we're doing it again.
Now, you have a panel of experts standing by to answer questions. Could you tell me a little bit about that panel?
So the panel is the committee that is the Beyond the Read committee. And so what they do is they work very closely with the editor of the journal, so Linda Fetters, who helps identify the article that will be free to anyone to read. Then this committee takes a look at the article. Obviously, they read it, they synthesize it, and then they come up with the post-test questions. And so they're a group of individuals from a range of backgrounds in pediatric physical therapy, from both a new professional all the way to folks who've been practicing for years. And then they also have geographic diversity and also their roles. So some teach in university settings, some are clinicians, and so it kind of has a broad perspective in terms of bringing then this course to life in the Learning Center.
It's an opportunity for the reader to dig a little deeper into at least one of the articles in each issue and to think about it, to then take a quiz to test his or her knowledge about the content. And it gives an opportunity, I think, to go in a little bit deeper than one might typically, which I understand. But it's a nice opportunity for that. And it's a way to get continuing education credit towards your professional status.
Right. So what do you do as a reader of Pediatric Physical Therapy, which is already very complete? You find an article that interests you that's featured in Beyond the Read. What do you do?
Well, the article is really chosen by the committee and in consultation with me. And it is the one free article in every issue. We have a single free article, and we try to make it an article that would be of interest to many of the stakeholders in the topic. So if it's on something like cerebral palsy, we'd want to make it of interest to therapists, also psychologists, possibly pediatricians, parents, people that work in programs with children with cerebral palsy. So it's free. They can access it without having to be a member or have a subscription. And then that's the featured article. So in the journal, it appears with a little logo that's Beyond the Read. So they know this is the article that we're featuring this issue. And this is the article that you're going to receive continuing education for.
I think that it definitely has some multiple facets to it, and that once you read the article journal, and that you will then search for additional articles to support what you're finding and draw readers into PT journal. But I think that, the pediatric journal. But I do think also that it gives us a way to capture what we're doing as clinicians. We spend time reading articles, but we don't get credit for it. This will allow therapists to get professional credit towards licensure by simply doing what we're already doing and reading an article, synthesizing it, and demonstrating our understanding of it.
Mm-hmm.
Well, I think Beyond the Read is a good exercise in how should I be reading literature if you're new to it. If you're interested in the topic, so you may be experienced in reading research, but this is a particular topic, it gives you an opportunity then to discuss this with others and to kind of expand your knowledge and your thinking. But I think as a template for reading research, it's quite a nice feature. And it should really be helping the readers, I think, fine-tune their analytical skills